morning. This is Tina Nordine's physical for the first week. Our patient's coming in. Hey, good morning.
Good morning.
Mr. Nordine, good morning. Nice to see you. If you'll have a seat here, as you were walking in, I was making sure that I assessed your gait and your walk and your posture. And at this point, I'd also like to see if I can get you to consent, and if I can have my videographer come over here so he can make sure that he has both. My videographer is a young kid, so making sure that we have the videographer, making sure. Mr. Nordine, I want to make sure that you consent to the assessment here this afternoon. Is that okay with you?
Yes.
You do consent. Okay, very good. So a couple of things that we're going to do is first find out what brings you here today to see us. See me.
Just get my yearly physical.
Your yearly exam, okay. And as you're speaking, I'm also assessing your vocabulary and how you're speaking, and also making sure that you're not saying or can you repeat that? That means that I'm also assessing your hearing as we go through this assessment as well. So as we're getting started here, the first thing I'd like to do is try to get a little bit of a health history from you, and then make sure that we've covered all of our bases. So first of all, is there any chief complaint that you might have that brings you in today?
No.
No chief complaints, okay. So making sure that we're assessing your history. Have you had any historical history in your health? Anything that has been going on?
I had a cervical neck fusion.
Okay. When did you have that cervical neck fusion?
In June of 2017.
Okay. I believe in your chart, I just reviewed it. It was 2018.
Yeah,
we can
2000.
We can certainly look at that as well. Not a problem. I was just looking at your chart prior to you coming in as well. So as we go over all of this, you said that you have no chief complaints today. So I wanted to make sure that we talked. Firstly, you're 49 years old. Is that right? Caucasian male. I can see that. Did you come here to the clinic with someone, or did you come alone today?
Alone.
Alone. Okay. And you able to drive well and were safely here, used your seatbelt and all of that, and got here safely. Is that correct?
Yes.
Very good. And no chief complaint. Just let me talk to you a little bit about a family history. And when we talk about a family history, we're talking about your immediate family, mother, father, and your grandparents. When you talk about a family history, do you have anything that is significant in your family history that you would like to share with me? Mother, father, or your grandparents on either side?
Yeah, my grandparents died of cancer.
Okay, both?
Well, 3 out of my 4.
Okay, so maternal side and your paternal side. Okay. And your parents are still living?
My father passed away.
Okay, I'm sorry to hear that. Can you share with me why, in what way he passed away?
It was an accident, so it wasn't really a condition.
Okay, all right. And did he have any other health history as well? Hypertension, diabetes,
Yeah, I think they both had hypertension.
Both your parents have hypertension. Diabetes, have you heard of either type 1 or type 2 diabetes?
No.
Any cholesterol issues, lipids, high cholesterol, anything like that?
No.
Okay, all right. And you did say that your grandparents had cancer, is that correct?
Yes.
Okay. And as far as your living situation, who is it that you live with?
My wife and 2 kids.
Okay. And how old are your kids?
17 and 14.
Okay, so they're getting on up from that age. Giving you any stress or any other issues?
Not too bad.
Not too bad. Okay. So a couple of other things. Well, I know we talked about your surgical history and your surgical fusion here. Have you had any other surgical history that you would like to share with me today? No other surgery. Okay. Allergies. Are you allergic to anything in the environment? Trees, nuts, grasses, pollen. Okay. Do you take any medication for that at all?
No.
Maybe an over-the-counter medication?
It's
Zyrtec,
occasionally.
Claritin? Okay. Occasionally you do take
A Zyrtec.
a Zyrtec. Okay. 10 milligrams. That's a normal dose.
Yes.
Okay. Very good. And then, do you have any allergies to food?
No.
No allergies to any types of food. Nuts, eggs, strawberries,
No,
any
I'm
peanut
aware of.
butter. Okay. Any drug allergies, medication allergies?
Not that I'm aware of.
And then, how about, do you take any medications currently?
I take a high blood pressure pill and a reflux pill.
Okay, do you know the name of your high blood pressure pill? I did look at your charts, I do know what's on the
Lisinopril.
lisinopril. Okay, and do you know the dosage of that?
10 milligrams.
10 milligrams QAM, or how
Daily.
often? Daily. Okay, very good. Do you take anything else?
Zantac twice
Okay.
a day.
And that's twice a day. Okay, BID. Very good. And how is that maintaining? Have you had a history of hypertension in the past, and are you being maintained with that?
Yes.
You check your blood pressure pretty regularly. Okay, very good. And then chemical history. When I say chemical history, I mean any tobacco abuse,
No.
alcohol abuse, social drinker, or anything? Social. Would you say you drink 1 to 2 beers a week, 3 to 4 beers, or more than that?
No, just less than that.
Less than that. Okay. And then any other substance abuse that you
No.
can think of? All right, very good. And then caffeine. Do you drink caffeinated, maybe coffee in the morning? Any caffeinated beverages?
Yeah, I drink mellow yellow in the morning.
Okay, 1 milliliter a day, or
Sometimes more.
sometimes more? Okay. Well, that can definitely add to, some issues with hypertension. It can other issues with your health history. So we can definitely talk about that too when we discuss, your diet and exercise and other plans. Okay. All right. So we're going to also talk about a review of systems. So we've talked a little bit about a consent. We've talked about your family history. We got a little bit of background on your physical history. And now at this time, we're going to do a review of systems. Is that good with you? All right, very good. So there's 14 systems. The first one is called constitutional, and that's when I ask you, and I know that my nurse also checked your temperature, and I ask you if you've had any history or recent history of fever or chills, anything like that, weight loss or weight gain or any type of weakness. No, nothing recently that you've noticed. All right, and then as far as your eyes, that would be your next system. Have you had any vision loss or vision impairment, any pain in your eyes,
No.
double vision, redness? Do you wear glasses?
I don't.
How about contact lenses?
I don't.
No? Have you had a history of glaucoma or cataracts? No? And then do you remember the last time you had an eye doctor visit appointment?
Yeah, I've had one within the last year.
Okay, very good. And we do ask that you can have a yearly checkup for your eyes as well. So as far as the next section, your ears, nose, and throat, have you noticed any ringing in your ears, any hearing changes,
No.
any dizziness
No.
as you're walking, any discharge from your ears, or any pain? And then your nose, congestion. Have you had a runny nose? I know you said you had some pollen allergy, but have you had any other than that, runny nose or congestion? Okay. And sinus pain. Here's your sinuses. Would those have any issues here? And then we just discussed your pollen allergy. And then sore throat, hoarseness. Have you noticed anything like that?
Have.
Changes in your voice,
No.
mouth sores.
No.
How about your teeth? Are you wearing any dentures or any other appliances?
Not.
And then how about your last dental visit? Do you remember the date of your last dental visit?
I don't, but it was a couple months ago.
Okay, and we ask if you can every 6 months to have a cleaning, dental cleaning, if you're able to do that. As far as cardiovascular, I know we talked a little bit about your family history of hypertension, and I believe you told me that you do take lisinopril for your hypertension, and you're able to maintain that. Have you noticed any chest pain or any discomfort, palpitations or racing heart? I'll read a couple more, and if there are anything that you do have, if you'll just indicate yes or no, okay? Shortness of breath with activity, difficulty breathing or lying down, swelling of maybe your extremities, sudden awakening in your sleep, high blood pressure we talked about, high cholesterol. heart attack, or leg cramps. Have you had any leg cramps? Not that you know of. As far as the next system, it's the respiratory system. Again, if you'll just indicate yes if you've had any of this. Cough, sputum, coughing up blood, wheezing, shortness of breath, or any type of painful breathing. No. The next system is the gastrointestinal. That's your stomach area. Have you had any problems swallowing, heartburn? I know you said that you do have a history of GERD and you do take a Zantac for that, BID. Does that seem to be able to help you tolerate that?
Yeah, I noticed though if I don't take it, it bothers me.
Okay. Make sure you're able to take that medication as prescribed. Any change in appetite, nausea, vomiting,
No.
diarrhea, or constipation? Change in your bowel habits, loose stools, blood in your stool. Have you had a colonoscopy? I know you're almost 50.
I have. I've had several because of my history, but it's been a while. I'm not sure when the last one.
And when you say because of your history, it's
Because of my
family history of colon cancer. And I know we did not discuss what specific kind of cancer your family had, but it was colon cancer. And so I know that we have that in your chart as well. As far as your genitourinary system, have you noticed a decrease in the flow or the stream of your urine? Any hesitance in having to urinate or frequency? Have you had to get up more often to go to the restroom? Urinating at night? Any discharge, penile discharge or erectile dysfunction? Change in your libido or any sexual practices that are that you would like to share? No. As far as musculoskeletal, that would be the next system. Any types of pains in your joints or muscles, back pain, redness or swelling of your joints, or any injuries or other surgeries, joint replacement surgeries or anything?
No.
All right, and then the next system is the integumentary system. That's your skin. Have you had any rashes, lumps, itching, your hair? I would definitely look at your hair and your scalp. Any changes into your nails? Any new moles that you've noticed?
No.
Any pain in your breast? And also men can have pain in the breast or pain or lumps in their breast. We do ask that you periodically do a breast exam as well. And then the next system is the neurological system, and that's where you would have any head injury, any headache, any type of fainting or seizure activity that you know of. Okay. So we looked at the 14 systems as well, and we looked at your your past medical history. So based on all of that history, I wanted to make sure that I included all of that in our assessment today. Do you have any questions or anything else that you'd like to share with me?
No.
Okay. As far as a risk assessment, I know that you do have a history of colon cancer, so I want to make sure that we discuss that you have a colonoscopy probably every 5 years. And then as you have hypertension, you also want to make sure that you maintain your blood pressure, checking your blood pressure, and continue with your lisinopril. And then obviously with your health and eating and diet and exercise, we want you to get some aerobic activity, probably 30 minutes a day if you can, light aerobics, and then make sure that you're eating well as well. Okay? So Mr. Nordine, I thank you so much for coming. I'm going to do a little bit of a charting here as we discussed all of your health history, and I look forward to seeing you probably in 1 more year. You're pretty healthy, so we'll bring you back in a year to follow up with your assessment, okay? Thank you, sir, and I hope you have a good afternoon.
Thank you.
Thank you.